Welcome to this video on the complications of high blood pressure. Uncontrolled blood pressure permanently injures blood vessels. Once organs lose their vital blood supply, the physiological damage can quickly become irreversible. High blood pressure, or hypertension, causes damage slowly and silently, affecting nearly every major organ system. We begin with the arteries and the circulatory system. Hypertension constantly pushes against artery walls, causing long-term structural injury. This leads to damaged and narrowed arteries, an increased risk of life-threatening aneurysm formation, and accelerated atherosclerosis, where plaque buildup compounds cardiovascular risks. Next, let's look at heart complications. Hypertension forces the heart to work harder, which eventually weakens it. This can lead to coronary artery disease, left ventricular hypertrophy, or heart failure, where the heart becomes too weak or stiff to pump effectively. The brain is highly sensitive to blood flow changes. Neurological complications include transient ischemic attacks, or mini-strokes, and actual strokes, where damaged vessels can burst or form clots, leading to permanent brain injury. Chronic reduced flow can also result in vascular dementia and mild cognitive impairment. Kidney health is also at risk. Kidneys rely on healthy vessels to filter blood. Hypertension can cause chronic kidney disease by reducing filtration ability, leading to waste buildup. In severe cases, this progresses to kidney failure, requiring dialysis or a transplant. High blood pressure also impacts eye health by damaging delicate retinal vessels. Complications include hypertensive retinopathy, which can lead to complete vision loss, as well as choroidopathy, involving fluid buildup under the retina, and optic neuropathy from reduced blood flow to the optic nerve. Hypertension contributes to metabolic syndrome, a cluster of conditions that dramatically increase cardiovascular risk. This includes high blood pressure, high blood sugar, high triglycerides, low HDL cholesterol, and excess abdominal fat, all of which raise the risk of heart disease, stroke, and diabetes. Sexual health is another area affected by blood flow problems caused by hypertension. In men, this often manifests as erectile dysfunction. In women, limited blood flow can cause symptoms such as vaginal dryness and difficulty achieving orgasm. A hypertensive emergency with blood pressure at or above 180/120ths of a millimeter of mercury is a severe medical crisis. This sudden severe rise can cause immediate, irreversible damage to the heart, lungs, brain, kidneys, and, in pregnancy, can cause dangerous complications. Seek immediate hospital care if these symptoms develop. To summarize, why do these complications occur? Simply put, blood pressure is the force of blood pushing against artery walls. When this is too high for too long, arteries stiffen, organs receive less oxygen, tissues become damaged, and critical systems eventually fail. Lifestyle factors play a major role in managing blood pressure. Key areas to address include maintaining a healthy diet, staying physically active, managing weight, limiting alcohol intake, avoiding tobacco use, and finding healthy ways to cope with chronic stress. Prevention and early detection are essential. Strategies include routine screenings, even if you feel healthy, monitoring blood pressure at home to track trends, and seeking patient education to better understand risk factors. Create a customized action plan with your healthcare provider for effective management. Always remember the two key takeaways. First, hypertension is a silent threat, meaning it can cause significant damage before you notice any symptoms. Second, it is important to be proactive with mitigation, making necessary lifestyle changes to reduce your risk for future health problems. In summary, hypertension threats are varied and severe. From heart attacks and stroke to kidney disease and vision loss, these complications are serious. Cardiovascular health, including preventing atherosclerosis and heart failure, relies on consistent blood pressure management. The process of how hypertension causes health problems happens in stages, starting with vessel damage and plaque formation, leading to atherosclerosis and blocked flow. We encourage you to utilize the available educational resources and interactive tools to stay informed about your heart health. To protect yourself, start by knowing your numbers. The most reliable way to identify high blood pressure is to have it checked regularly. While home monitors and public stations provide useful data, always consult a healthcare professional for an official diagnosis. Understanding your risk is equally important. By identifying the factors that make you more susceptible to high blood pressure, you can proactively learn what increases your chances of developing serious, long-term health complications. Taking action is the most critical step. Manage your blood pressure by adopting a heart-healthy lifestyle, strictly following prescribed medication routines, and maintaining open, consistent communication with your healthcare team to effectively reduce your risks. Recognizing a hypertensive crisis is vital. If your blood pressure exceeds 180/120ths and is accompanied by symptoms like chest pain, shortness of breath, numbness, weakness, or vision changes, this is an emergency. Call 911 immediately. Do not wait to see if the pressure drops. Thank you for watching this educational video. We appreciate your time and dedication to learning about blood pressure health. For further information and resources, please visit the links provided on the screen.